Please welcome with a big hand Dr. Christoph Zinner. Good morning, Mr. Zinner, dear Christoph. I would like to ask two questions. What do you actually do with police?
First of all, I'm responsible for the sports training of our colleagues in Hessen. We've got the curriculums. I get them fit during their bachelor studies, and in parallel to the normal police officers, I'm responsible for the top athletes, the groups in Hessen, so that they can do their sports while they undergo police training, and they are supported by the police during World Championships and Olympic Games.
Very interesting, and you're also involved in research.
Well, as far as possible.
What is your focal research?
Well, in my PhD in Würzburg, I did a lot of research in terms of physiology, endurance, and then strength training, resistance training, and for the police, of course. What is important is physical performance in general, which is interesting. It's difficult to say only endurance, only strength. No, we try to get the overall package and include everything what is needed for police-specific purposes. This is the goal.
Sounds very intriguing. Our friends and helpers have to be fit after all, and this is why I'm all the more delighted to listen to this lecture by Dr. Christoph Zinner. Please enjoy.
So good morning, ladies and gentlemen. An official welcome on my part. Metabolic training with EMS. This is a topic I haven't been dealing with for a very long time, 2 years now, and I found that so far we know relatively little. There are many studies that have been conducted in terms of strength training or the improvement of the skeletal system, but in terms of metabolism and how it changes due to EMS training is something that hasn't been researched at in great depth. So I would like to deal with the impact of EMS on metabolic parameters in general, and what impact has EMS on classical endurance training, metabolic training. I would like to divide my presentation two parts. What is the impact of EMS on metabolism, on the basal metabolic rate? And second, what studies do we have on classical endurance training supported by EMS stimulation? What is the impact? And we end in terms of current research and what we are working on at present. I will show you a few studies. Mr. Kemmler's working group has done quite a lot in terms of EMS, and they conducted a few studies on energy expenditure during exertion. It's a classical EMS training we are talking about here. The trial, the test persons were relatively well-trained sports students here. The settings in training were used, as you know, from the classical EMS studio area. They performed a training with an overall period that is usually being applied in EMS studios. The EMS intensity was turned up to a maximum tolerance level so that the training was feasible, was doable, but a little bit more intense than what you find with clients in the fitness studio. So apart from the 8 classic muscles that were stimulated by means of EMS, we also undertook classical exercises, you know, from a gym under EMS impact or even without EMS, squats, biceps curls, arm extensions, or dynamic exercises that were performed in order to establish the impact and the difference between normal standard training when I do this and then, in addition to EMS applications. What differences do we have in terms of oxygen intake? You see the masks people are wearing. What are they breathing in, breathing out, inhaling, exhaling? And you can see, the energy expenditure of the test person during the 16-minute training period. Looking at the EMS group in 16-minute training, 412 calories were then used. It's quite a lot for 15 minutes of training, even if it's intense, and the control group, the same training training unit without EMS, they burned 60 calories less. That's about 70% difference to a 16-minute training. So in this period of time, is the energy expenditure with EMS is significantly higher than without. This might sound banal. I've got more muscles that are stimulated during EMS training. It's more than doing squats where only thigh muscles or biceps curls come into force, and with EMS, whatever is stimulated has to be active. And here I give you the figures. The difference right here is 1/6 of energy more is being consumed when I train with EMS. So it's more intense on a Borg scale from 6 to 20. It's comparable with the classical 0 to 10 scale we know from EMS. So the EMS training group, even though the feeling is the same level of intensity as the non-EMS group, they found that it was more exerting compared with the no EMS group. So this is what EMS training contributes. It's not a bad thing. So even though training intensity is the same, EMS training, as we know, is much more intense and more strenuous for the test persons than the same or a relatively similar study was conducted by an Italian working group. It was released last year. They focused on static and isometric exercises, posture exercises. The way you know, they chose nearly the same settings as Kemmler. The training period lasted 1 minute less, and thank God, and not surprisingly, the findings were absolutely identical, but the difference between the two groups is a little bit low in terms of metabolism. So when you have isometric exercises being performed, just this whole body plank posture here, there it seems that EMS and non-EMS do not differ as much as before when you take a look at metabolism. And what you can see here is, in terms of exertion, there was no difference between the two groups, with or without EMS. And this might be a good indication of, depending whether they are trained, well-trained or untrained, trial persons or advanced persons or beginners, maybe for the untrained or inexperienced people, or for patients that cannot take a lot of strain, that they nonetheless, when they use EMS, have got a 10% higher metabolic rate based on EMS application during a 15-minute training period. This is really interesting when you think about it, when you know how EMS works, that simultaneously more muscle groups are stimulated than the one I focus on during my exercise. So this doesn't only this means that it's not only type 1 and muscle fibers are activated, but type 2 muscle fibers too. So this is not a finding that is really something novel. So then we look at the post-training phase. Is this afterburn effect by the supposedly higher EMS training something that tells us that it makes sense? When you burn more with EMS training after the exercises, well, maybe it makes sense to go on this basis. And here a training unit was performed with EMS. And what you can see is 1 hour post-training, 12 hours post-training, 1 hour up to 72 hours afterwards. The resting metabolic rate was measured. How much is the energy is consumed when I just sit there at rest. So after 1 hour, it's 25% increase in resting metabolic rate. Interesting. when I've got highly intense, highly comprehensive whole body training can also achieve that, but I would need 45 minutes or 1 hour training to do so to achieve the same level of resting metabolic rate. The control group didn't train anything. So when I engage in strength training, normal standard strength training, or when I do the exercises in 15 minutes, just like with EMS, the curve would also go slightly up, but not 25% as with EMS. Here, this is a group that didn't train at all, and during a 72-hour period, this was measured, and nonetheless, the 25% increase is really staggering. Here the asterisks are then statistically significant, but also the 60-hour period is interesting because I still have the 10% higher resting, the basal metabolic rate than non-training persons. What is also interesting within the framework of this study is that within a period of 48 hours, we burned an additional 500 calories in terms of afterburn effect after 15 minutes of training. And what is all so interesting is the respiratory coefficient, scientific figures. So RQ shows whether in terms of fat, whether I'm in the area of fat or, carbohydrate burning. So pre-training carbohydrate burning was relatively strong. Thinking about it, I would like to reduce fat. I would like to slim down permanently. I would like to try to eat up my fat reserves in the bodies. So prior to the training, there's no major contribution to reducing fat. But 48 hours post-training, I've got a clear reduction. The 0.8 points is relatively high. Normally it's between 0.7 and 1, so that's the complete range. So the 0.8 is a major step towards fat burning, and apart from the overall calorie expenditure and consumption, it's really something for people who would like to reduce their fat reserves. So these are acute effects. We've got an acute increase in the metabolic rate based on EMS. We've got an increase over a period of 48, even up to 60 hours post-training in terms of afterburning. So what about chronic training here? Well, chronic effects. What is that? Well, when we did, studies were done by Kemmler with postmenopausal women, a long training period, 14 weeks. It's not being used in practice, but it's difficult to have longer studies in scientific terms. So 14 weeks is long for scientific studies, but in terms of basal metabolic rate and resting metabolic rate, Kemmler didn't ascertain any increase when comparing EMS and non-EMS training test persons. So what we see in training unfortunately isn't manifested in this one study, but unfortunately there are not many studies out there. Actually, there should be an increase in basal metabolic rate. I do not want to criticize the study. The study had different targets, but we had highly trained women there. The training status for their age was pretty good, and in addition, they put on EMS, and this didn't increase the basal metabolic rate. From my point of view, from a scientific point of view, from the point of view of somebody who worked with customers, the basal metabolic rate should have gone up also, something we should have been able to measure scientifically, but I cannot tell you why this didn't take place. So now let's turn to endurance. So the studies I presented is strength-based studies and the studies that measure the basal metabolic rate. This was done in scientific terms. And now let's turn to the classical endurance type training supported by EMS. I could see it in some of the booth here, some of the stands. It's there in the endurance program. Let's take a closer look at what is happening there. When we look at it from a scientific point of view, the first study by Mr. Wahl, an ex-colleague of mine, he took a look at two areas on a bike. Number one, it was a so-called, incremental step test, started easily up to a point where the trial persons couldn't take any more. Well, they had cycling 30 and 85 hertz. The settings you see here, 30 hertz, 85 hertz, the rest of the settings was identical. And the difference from what you often read, what Miha has got in terms of settings, the permanent impulse, the colleagues said, I take a tiny little break. I've got 10 seconds, 5 seconds intervals, due to the fact that the test persons get very well used to the EMS stimulation, and then they don't feel that a lot of things happen. And when the stimulation and the is switched on and off, there is this little tick that made the test persons feel and perceive something. But this was the reason for the non-permanent pulse rate that was chosen. As opposed to strength training studies, we only had gluteus and, calf, then electrodes, nothing in the upper body. What we see is the classical lactate performance curves I get after each incremental step test, running, cycling, whatever I do to measure my performance. In green, we have the non-EMS group, and in red and blue, the two groups with 30 and 85 hertz applications. And what we get is a much higher lactate values. And what I didn't show here, the test persons, they have got a test that is a lot shorter. They have to take a break 5 minutes earlier compared to the non-EMS group. So a much higher lactate generation due to the fact that when I add more fast-moving muscles, when I cycle, I've got endurance fibers that produce little lactate, and when by means of EMS I have the fast-moving muscle fibers, I have got a lot more lactates. And then here the respiratory quotient I mentioned before shows us whether we are burning fat or carbohydrates, and with then higher rates, I'm always there in the fat burning area. So when we apply EMS, we get up faster, quicker. And so when we want to have a metabolic rate, EMS is not maybe good in terms of endurance trainings based on these results at least. So what our colleagues also did, they measured cortisol as a stress parameter. There's no difference with or without EMS. So in molecular terms, the stress level of the training persons is the same that we measured CK, the delta, pre and post test was measured, and there's a significant increase in the two EMS intervention groups and a decline or a non-increase in the non-EMS intervention, minimal, and nonetheless I've got a slight damage to the muscles, even when cycling is a stress that does usually bring higher muscle damage. So EMS does what we know from strength training, but to a degree which is negligible indeed. And then Wahl conducted a second study, and test persons against all recommendations were then for 1 hour on a bike. For 1 hour I go running, and I just cycle along, only EMS ones, and then there were there was a control group. Then 1 hour on a bike without EMS, 1 hour without. So the same picture, clearly higher lactate values with the same intensity when EMS is applied. It gets more intense for the test persons, not only perceived but also measurable. Heart rate, no difference between normal cycling and cycling plus EMS. So control management, EMS training with heart rate. There you have to be careful because I cannot measure intensity. And then subjectively, it's more difficult stressful for the test persons, even though they had the same intensity in terms of cycling. We see it in strength training. When I perform the exercise without EMS, it's easier than with EMS, a clear effect. At the moment, we have conducted some prior pre-studies. EMS was used there. Well, we have to set then
Ganz gut, wenn
on the treadmill. We see we have got a slightly increasing protocol until the test person couldn't go any more. Without EMS, they have got higher intensities in running than with EMS on the treadmill. The same goes for cycling, as we found out. There with middle and high intensities, no difference in heart rate, but with lower intensities, there is a clear difference. When they start running and the EMS comes in, then the heart frequency, the heart rate is higher. Energy expenditure, metabolic rate during running, there is a higher metabolic rate, clearly higher than compared with non-EMS. And it stays the same, the delta stays the same, and adding up all of it, it's the plus we were hoping for by applying EMS. Here, one more. These were the acute examples, or what's happening acutely when I support endurance training by means of applying EMS. There's one study that looked at a 4-week training with well-trained sports students, and they did 14 sessions, 1 hour, 60%. So it is just loose cycling, buttocks, the gluts, the thighs, and the calves were stimulated with electrodes. This is slide on off to give a new stimulation to the trial persons. CK, significant increase, significantly a very high increase after the first 2 training sessions, and after 1 week, 1.5 weeks, it normalized again, and that I do not see any impact anymore. We see the same in the strength area, and so we've got these high increases in endurance too. So the results for the cycling group and for that cycling plus EMS, no differences. No matter whether I take a look at endurance and various parameters, sprint performance, maximum performance on a bike, no differences between the groups, or strength. These are the changes between pre and post, and in the strength area, even deteriorations. Not significant deteriorations, but the EMS training groups, and we cannot tell you why, comes out worse after training than before the training. Now we turn to science again. It's a study I want to underline here. Lipovic undertook a study with football players. It was about sprinting, and they also took blood samples to take a look at the erythrocytes for measuring oxygen levels and oxygen intakes. They said, well, how well can we deform erythrocytes? For a practitioner, it might not be so interesting. So for us, the scientists, erythrocytes must be deformable so that they can get to all the muscle fibers, and the stiffer they are, the worse it is. So this is the parameters. Well, elongation index, the higher the bar, the better. And then the EMS group, samples were taken before the training, then 15 minutes after EMS training, and 24 hours past EMS training, just like the group without EMS. There was no difference in erythrocytes elongation, but interestingly, after EMS training, there's an increase directly after the training. And then this is something we see over the 14-week training period. The EMS group then elongable erythrocytes after training. After 4 weeks, this effect is gone, while there is no difference in the control group. For us, the scientists, it is really interesting for explaining the mechanisms and why EMS works for endurance training purposes. We are often in this particular area of 80, 85 hertz. This is the frequency range EMS settings you find everywhere. This here is actually the range literature tells us that stimulates and activates type 1 fibers. I need low frequencies in order to mimic, to simulate endurance type training. A Kemmler study, apart from the 85 hertz training, also applied 7 hertz training in the strength area, but it was mixed, and so we cannot make a clear statement. There's one single study, and this is this one right here. They looked at one trial person, no training, only 7 hertz EMS on the sofa. What happens? You can see it 5 units per week, each and every night, over a period of 6 weeks. 45 minutes, 10 hertz, and we get an improvement, an enhancement of the parameters. Highly untrained test person, nice idea for a study. It's not scientifically meaningful, but this is what you find for a low hertz rate and EMS for improving endurance. Currently, I'm out there with a colleague from Cologne in a fitness studio in a gym. We look at, well, running, a stepper, rowing, ergometer. We want to know what happens between 730 and 85 hertz. We would like to open up the range a little bit, and then based on the acute results we will hopefully have in autumn, we would like to continue with a training study with only low hertz hertz range. This is my experience. Well, no warranties. I tend to use low frequencies for the endurance side. I know that it's not a very pleasant stimulus for the test person, but my experience is more positive than the 85 hertz setting. What I would like to do is I would like to build up relatively long contraction durations and then put in the brakes in order to give new stimuli every 10 seconds. So much for the current scientific studies in terms of metabolic training, and should you have questions, feel free to ask them. Thank you very much.
Well, thank you. Oh, yeah, the microphone now is working. Thank you very much indeed. Christoph, this was very revealing indeed. And what do we learn from this? Well, never trust a study or research you haven't forged yourself. So endurance training has not been covered by sufficient studies. If you still need a few trained subjects for your new study in Cologne, I'd volunteer. Questions, please.
Hello. Could you please give us the last slide you've shown? This one right here. So ramp, 2 to 3 seconds, this ramp up. Does it mean that every 2 to 3 seconds you increased intensity? You know, the ramp means that I do not move from the brake into a 100% impulse, but I increase it over a period of 2 to 3 seconds until I get the pulse. And
any other questions? If not, you're cordially invited to meet Dr. Christoph Zinner in our VIP settee, the corner over there. If there's any open issues you don't want to address in a wide audience, feel free. So thanks again, and a big hand for Dr. Christoph Zinner.